In Chapter 1, we will be covering the sports medicine team. As far as thinking of sports medicine as an umbrella term, we will be talking about the two different sides of sports medicine. One side is performance enhancement, which I also like to think of as injury prevention. And then on the other side, we have injury care and management. Professionals under performance enhancement would be people like exercise physiologists, sports nutritionists, certified strength and conditioning specialists, and possibly personal trainers, depending on the resources available to a given athlete. On the injury care and management side of sports medicine, we're talking about physicians, athletic trainers, sports physical therapists, possibly sports massage therapists, orthotists or prosthetists. Say, for instance, if an athlete has a disability that requires them to have a prosthetic limb, say, for instance, sports chiropractors, and again, maybe if there's the resource available, the athlete might be seeing an acupuncturist or another type of medical professional as well. There are many types of sports medicine organizations that professionals may belong to. As far as the medical side, as athletic trainers, we have the NATA, or National Athletic Trainers Association, that is our governing body. For orthopedic surgeons, they have the AOSSM, or American Orthopedic Society for Sports Medicine. Sports medicine doctors would be governed by the American Academy of Family Physicians, as they are considered family physicians first, and sports medicine doctors as a part of being a family physician. The American Academy of Pediatrics also has a sports committee, and the APTA, the American Physical Therapy Association, has a sports physical therapy section as well. As far as sports medicine organizations on the performance enhancement side, there are several organizations that will offer support for performance professionals in addition to certifications and different types of trainings. The first one is the NASM, or the National Academy of Sports Medicine. Next is the ACSM, or American Council of Sports Medicine. Next is NSCA, National Strength and Conditioning Association. And definitely last but not least, is ACE, the American Council on Exercise. So those of you who are going through the personal training program at Miramar College should be very familiar with ACE at this point, as you will be sitting for an exam with them. So they do offer that personal training certification. The NSCA also will provide a personal training certification. I believe the NASM also provides that. The NASM also provides some very interesting certifications that can be in addition to your regular personal training certification, such as Performance Enhancement Specialist. That's a very helpful certification and training that you can go through with them. And I believe they also have a very interesting sports nutrition certification as well. So I personally hold certifications with NASM and the NSCA, as I have a certification for a strength conditioning specialist, and for NASM I also have a corrective exercise specialist, which is the medical professional version of the performance enhancement specialist, and I found it to be very helpful in my career. So this is a relatively complete list of individuals who could be on a sports medicine team working with one particular athlete. This is not an exhaustive list, but there are some very good examples. And most athletes won't have every single one of these types of professionals working with them, but they could have one or five or more, depending on what their resources are that they have available to them. Many teams will have a team physician that works with the athletes. For universities and high schools, most often they will have an athletic trainer that's assigned to the team, and therefore to an individual athlete who becomes injured. There will usually be a coach for a team. The athlete is a really important part of the sports medicine team, as they are responsible for their own health as well. Sometimes we have parents getting involved, definitely at the high school level or younger, sometimes at the college level as well, given that oftentimes the student athletes are still on their parents' insurance. But again, we could have specialists such as a nutritionist or an acupuncturist or a sports psychologist that's also helping an athlete to heal the best that they can from an injury. In this next section of the chapter, we are going to be talking about the roles of some of the different members of the sports medicine team. So on this first slide, we're going to talk about the roles of fitness professionals working with athletes. So as far as fitness professionals, the first goal is to improve performance. But the neat part about that is while we're working on improving performance, if the fitness professional is doing a good job, they're also reducing the likelihood of injuries. So it's kind of a 2-for-1 deal there, which is great. I really appreciate that about fitness professionals working with my athletes as an athletic trainer. So depending on what level of athlete we're talking about, they're going to be working with different types of fitness professionals. So at a university or professional setting, we're going to have the athletes working with a certified strength and conditioning specialist, most likely. For a recreational athlete or possibly even a high school athlete, they may be working with a personal fitness trainer. If they have that available to them, say for instance at their gym, or they may still be taking PE, or maybe their parents, have more money than they know what to do with, so they're working with a CSCS and a nutritionist and a sports psychologist. I've had some high school athletes that have had all those things available to them, plus a life coach. So every individual can be different. So again, that Certified Strength and Conditioning Specialist, or CSCS, does strength and conditioning for athletic populations in particular. So not as much for a general population, although I guess it is possible. For CSCS is working with athletes that are undergoing rehabs with an athletic trainer or a physical therapist. They need to defer to that athletic trainer or physical therapist when the athlete is participating in the strength training program. So they may not supersede, what the athletic trainer has told the athlete as far as their limitations. Fitness trainers, all fitness trainers should be, personal trainers should be CPR and first aid certified. And again, it's becoming more common, provided services for post-rehab and sports conditioning, possibly for people who do not have access to a certified strength and conditioning specialist. Depending on somebody's insurance, they may not get very many rehab visits. They may not get enough visits for an injury to actually be completely healed from that injury. So they may look outside to other resources they have available to them to try to continue to heal. So as personal trainers, you may actually see somebody who's still recovering from an injury. So it's important to understand what those injuries entail and have some idea or some understanding of how the body heals so that you don't do more damage, basically, and that you're able to help that person continue to heal. So the roles of a coach when it comes to working with an athlete can vary somewhat depending on what the other resources are available to that athlete, but some general responsibilities of a coach would be development of a preseason conditioning program, especially if that person does not have a certified strength and conditioning specialist available to them. They're going to supervise warm-up sessions prior to daily practices. And of course, they're going to coach. So they're going to give instruction on proper techniques for the sport and or positions played. Another important aspect, especially in equipment-intensive sports like football and ice hockey and lacrosse, and I'm sure there are others that I'm not thinking of off the top of my head, the coach needs to assess the quality, effectiveness, and maintenance of protective equipment. This is very important for injury prevention, especially things like helmets and shoulder pads and things like that for those equipment-intensive sports. It's not just the coach's responsibility though. It's going to be the coach's responsibility. If the team has an equipment manager, they will have responsibility there. Obviously the athlete, since it's their own equipment, will have that responsibility, and the athletic trainer will have that responsibility. So say for instance, if I see somebody running around on the football field and their chin strap's not snapped, then I'm going to want to check on that and make sure it's functioning properly so that the athlete's helmet doesn't fly off when they get hit and then they get a concussion, say for instance. If the equipment manager noticed that, it would be the same thing. It would be their responsibility to help fix that as well. Same thing for the coach. So some of you may be asking yourself, what is an ATC, or what is a certified athletic trainer? ATC actually stands for Athletic Trainer Certified, but we usually refer to ourselves as certified athletic trainers. The certified athletic trainer is a highly educated and skilled professional specializing in athletic health care for the physically active. An athletic trainer is not a profession or a specialization in personal training. Totally different. An athletic trainer is a sports medicine professional. They're a medical professional. They're not a personal trainer. There are some personal trainers that call themselves athletic trainers, but what they really mean by that is they are personal trainers who like to work with athletes. It is not the same thing. Athletic trainers can work in many different types of settings. A traditional setting for an athletic trainer would be attached to teams at a high school, college, or even professional sports. In a high school, the athletic trainers will probably be covering multiple sports. So one athletic trainer might have every sport at the high school, or if it's a very big high school and they have a lot of money, there might be 2 athletic trainers, although that is somewhat unusual. At the college or university level, most often there are multiple athletic trainers, but one athletic trainer will probably still cover multiple sports. It depends on how elite the university or the sport is, but usually an athletic trainer will still have 1 to 2, maybe 3 or 4 sports. On the professional level, there will be multiple athletic trainers for one team. So basically, the more elite the sports get, usually the more bodies that are assigned to that team. Now, outside of that traditional setting of athletic trainers, we have a clinical setting. So a clinical athletic trainer is going to work in a physical therapy clinic or possibly a sports medicine or orthopedic doctor's clinic. In a physical therapy setting, oftentimes athletic trainers will have their own patient load. So I personally work at a spine clinic where I see my own patients. The physical therapists in the clinic sign off on my notes and are there for help if I need it. But generally speaking, I'm responsible for my own patients. The physical therapist will do the initial evaluation and the final evaluation, but other than that, I'm able to see the patient the rest of the way through their rehabs. In a clinical setting for sports medicine or orthopedics, the athletic trainer usually does things like an intake when the patient first comes into the doctor's office. They will do a history similar to what a medical assistant would do, but we're able to do that in a more in-depth manner. The athletic trainer may, depending on the setting, be able to order x-rays if they think it's warranted prior to the doctor seeing the individual. They may be able to do some special tests before the doctor does them to kind of direct the doctor's exam. And they will, after the doctor has seen the patient, the athletic trainer may give the person a home exercise program. So that's the clinical setting. As far as the non-traditional setting, common non-traditional settings would be things like military or tactical athletic training. So a military athletic trainer will be attached to a battalion, say for instance, and may be actually having a station set up out in the field while the troops are doing their physical training, doing their PT. And if somebody gets hurt while they're out there, the athletic trainer will help with that. Other military athletic trainers work in what they call smart clinics. So a smart clinic is similar to a physical therapy clinic, and and maybe even I think there are doctors there too that will see the injured troops as well. So, but they do all their own in-house intakes and rehabilitations in those smart clinics as well. And the athletic trainers are doing a lot of the work there. Performing arts is another non-traditional setting that is common. So in performing arts, athletic trainers would be attached, say for instance, to a particular Cirque du Soleil troupe. And that's one job that we'll see come up a lot for athletic trainers. And also medical equipment sales. There are two companies in particular in Vista, DJ Ortho, which previously was called Donjoy, and Bragg International. Both of those companies really like to hire athletic trainers to work in their companies because they have traditionally done that, and they found athletic trainers to be very highly skilled at marketing orthopedic medical devices. So as far as the requirements to become an athletic trainer, currently the minimum requirement for athletic trainers is to obtain a Bachelor's of Science degree from an accredited university. There is movement towards the minimum requirement becoming a master's degree in athletic training, similar to a physical therapy degree becoming a doctorate from a master's several years ago. So far, that is not the current standard, but it is probably going to be switching to that within the next couple of years. So currently, Bachelor of Science is the minimum standard. During that Bachelor of Science program, the student will get a strong education in anatomy, physiology, biomechanics, ex-phys, nutrition, pharmacology, and general medical conditions and disabilities. It is also required that somebody becomes CPR and AED certified prior to sitting for the exam. And first aid is not required because our training actually exceeds that minimum standard set by first aid. So sometimes individual jobs want athletic trainers to have first aid training, but it always kind of makes me laugh that that's required because our training far exceeds first aid training. To become a certified athletic trainer, an athletic training student who has finished that degree from the accredited university will also take and pass the NATA Board of Certification exam, which is a very challenging exam that takes about 8 hours to complete. And the student will have spent 2 years in their program preparing for that exam, and then they'll probably spend at least 2 weeks to a month studying outside of their coursework to try to make sure they're prepared for that exam to be able to pass it. It is fairly challenging, but most of the programs do a very good job of preparing people for that exam. Once somebody has become a certified athletic trainer, to keep their certification, they need to participate in continuing education units. So the requirement for us is 75 CEUs a year, so that's actually 75 contact hours every 3 years, excuse me. So it's about 25 contact hours a year, which is easily met by attending our national convention, or other options would be things like home study programs or something like that. So as far as the information on this slide goes, we're looking at the role of the athletic trainer as it is stated, the roles of the athletic trainer as they are stated in your textbook. Just for comparison purposes, I put my personal spin on trying to talk about how a personal trainer may have some responsibility towards some of these roles as well. This is absolutely not an exhaustive list of the roles that a personal trainer would hold as far as their job requirements or anything like that. It is just a comparison, contrasting to the roles of the athletic trainer based off of what's in your textbook. So this is primarily my opinion based on what I know of personal training. So again, it's not going to be an exhaustive list of responsibilities by any means. As far as the role of the athletic trainer, and personal trainer, both of these individuals are going to be responsible for prevention of injury. Athletic trainers only, along with physical therapists and physicians, will be responsible for evaluation. Both athletic trainers and personal trainers will be responsible for some amount of immediate care of an injury that happens in front of them. Athletic trainers will do treatment and rehabilitation of an injury. Personal trainers may help a little bit with late-stage rehab, again, as a rehabilitation adjunct. Athletic trainers definitely have responsibility for organization and administration. A personal trainer may, depending on their work setting. And both athletic trainers and personal trainers have professional responsibilities with regards to their own profession. As far as injury prevention goes, we also consider injury prevention as being risk management when it comes to a university or a business. So it is very important. For both athletic trainers and personal trainers, we want to ensure appropriate training and conditioning of the athlete. For athletic trainers, that's most often something we do following an injury. So we'll make sure that somebody is completely ready to go back to play prior to allowing them to return to play. As far as risk management goes, that's the best way to do things, at least. We do have a responsibility outside of if a team does not have a certified strength and conditioning specialist. Sometimes athletic trainers will also help the coaching staff make sure that people are getting appropriate training and conditioning as well. Personal trainers are definitely going to be in charge of that training and conditioning of the clients they're working with. Both individuals are going to be responsible for monitoring environmental conditions to ensure safe participation. With athletic trainers, it's our job to make sure that environmental conditions are not endangering the health of our athletes. So things like paying attention to the heat index, making sure people aren't exercising when it's too hot out, or making sure that we are practicing lightning safety to make sure that nobody gets injured by lightning. If a personal trainer is doing workouts outdoors, that is definitely applicable as well. But say, for instance, if the air conditioning breaks in your facility, you also are going to want to make sure that you're monitoring the health of the participants in the heat that occurs when the air conditioning is broken as well. So as far as athletic trainers go, we're going to want to make sure that people are selecting properly fitting and maintaining their equipment. The athletic trainer is going to assist the coach, athlete, and equipment manager as needed. Again, it's not necessarily a primary responsibility, but it is really important to make sure that everybody is safe with their equipment. It's a major thing for injury prevention. For both the athletic trainer and the personal trainer, we want to make sure that we're aware of proper nutrition for athletes and clients. So having an idea of what's appropriate as far as nutrient intake is very important. Also being aware of fad diets and how they might affect performance. I know in our family, my husband is a very big fan of the paleo diet. He was able to lose almost 40 pounds by following the paleo diet for a few months. It worked really well for him for weight loss. Now, if he was trying to also improve his performance in sport at the same time, I have a feeling that his performance may have suffered just because he wouldn't be necessarily taking in enough carbs on the diet that he was following to be able to maintain his blood sugar and the available glycogen and glucose stores needed for working out at a high level. So I definitely had athletes who started low carb diets right before two-a-days, and they were miserable the entire time. One in particular actually ended up quitting the team because her body could not handle it. It's not that those diets are wrong or bad in any way. It's just we need to be aware of how those affect performance prior to recommending them for people who need performance as a part of their daily activities. The athletic trainer will also make sure athletes properly take medication. We may not prescribe medication, and we can't give out more than one dose of a medication at a time. So we may be able to give somebody one dose of ibuprofen, say, for instance. and we may be able to hand somebody their albuterol inhaler that they have been prescribed, but we will not let other people borrow somebody else's albuterol inhaler. We also might make sure that a particular individual isn't taking 4 times as much ibuprofen as they're supposed to, say for instance, and making themselves sick. So we just need to make sure people are being smart and safe with their medications. So when we're talking about injury, or also what we call clinical evaluation of an athlete, this is for athletic trainers or physical therapists or doctors only. Personal trainers would not be expected to do this. We have several aspects of things that we would look at with an injury evaluation. No matter what, we always want to obtain a medical history first prior to somebody participating. We will also have them do a pre-participation physical exam that will look at any pre-existing conditions that could put them at a higher risk for getting injured or ill or sick or dying, even. So those are super important things to rule out prior to somebody participating in sports. Once somebody is participating in the sport, we want to efficiently and accurately evaluate injuries. Depending on the exact setting that we are evaluating the person in, that's going to determine exactly what efficiently and accurately, or which one of those things is going to take place the most. If I'm on the rugby field and I have somebody get injured, I have less than 5 minutes to know exactly what's going on, treat them, and let them continue to play or get them off the field. So it's not very much time. So on the rugby field, efficiency and making sure the person is safe is most important. Knowing exactly what degree of injury they have to their specific ligament in their ankle is maybe not as big of a thing as knowing how functional they are. However, most of the time, because I'm good at my job, I've been doing it for a long time, I'll know by the time somebody's off the field possibly which ligament they've sprained in their ankle. As a personal trainer, you wouldn't be able to tell that. You wouldn't have the skill set. Physical therapists would also be able to tell that as well. We need to understand the pathology of injuries and illnesses as athletic trainers to be able to accurately, again, diagnose those or evaluate those injuries and illnesses. As personal trainers, people would be expected to understand generalities. So if somebody came up to you and said, I'm diabetic, you should have some idea what that means. It doesn't mean you can treat them for their diabetes, but you should know that blood sugar is a big part of that. And then if somebody gets low blood sugar, they could have a really bad training session. Or if their blood sugar is high, it could be a medical emergency. So things like that. We do want to be aware of when to refer to a physician or support services as athletic trainers. So as an athletic trainer with a lot of experience, it's very rare for me to have to, say for instance, refer an athlete to a physician for an ankle sprain. I can tell how bad somebody's ankle is sprained by doing my clinical evaluation. If I send somebody to the doctor with what I know to be an ankle sprain, all that's going to happen is the doctor's going to x-ray it, say it's not broken, send the person back to me saying, please rehab this ankle sprain. Now, if I'm evaluating somebody, I say, I don't know, I think that there's a possibility that there could be a fracture here, then I'm going to send them to the doctor to make sure there's no fracture prior to starting rehab for that ankle. But say, for instance, if I'm evaluating somebody's knee and I feel that they have the possibility that they've torn their ACL, I'm not going to try to do my own rehab for that person without working towards getting them to see the doctor. I might start some exercises prior to them seeing the doctor because I know I can do that without hurting them worse, but I'm not going to try to keep them with me only and not have them see a physician. So we want to know when it's appropriate, what we can handle on our own basically, and what needs to be seen by a physician. As far as immediate care of injuries and illnesses, personal trainers, athletic trainers, anybody who witnesses an injury or an immediate illness is going to be responsible for this to the level of training that they've had. So a personal trainer would be primarily responsible for providing general first aid, CPR, things like that. As an athletic trainer, again, our training is a little bit more in depth than that, so we would be expected to do more. So as athletic trainers, we'll do an initial what we call on the field injury assessment. So say, again, on the rugby field, somebody falls down on the ground and is grabbing onto their ankle. I'm going to run out into the field and try to determine what happened to their ankle. Did they break it? Did they sprain it? Do they have a Charlie horse? Maybe they're just grabbing their ankle because it's near where their calf is cramping. Try to figure out exactly what's going on and how bad it is. If I run out there and they say, "Oh, my ankle hurts," and ask them, "Well, on a scale of 1 to 10, how does it hurt? How much does it hurt?" And they say, "Oh, it's pretty mild. It's like a 1 or a 2." Then that's not a very severe injury. Now, if I run out there and I look at their foot and it's facing the wrong direction, then I know that's a severe injury. That's a fracture or dislocation of the ankle. So it can be either really easy or a little bit less easy to figure these things out. But as athletic trainers, we're trained to do that relatively efficiently. Again, as an athletic trainer, we're going to do that very in depth. If somebody's a personal trainer and trying to figure this out, you might just say that individual hurt their ankle, and I can't tell necessarily how bad it is, or I can tell that their foot's facing the wrong way. This is really a big deal. We're going to call 911. So if you can't tell how bad something is, then we just kind of imagine that it's something that the person shouldn't be walking on. Again, as an athletic trainer, we would know whether or not it was safe for them to do that. If somebody doesn't have that amount of training, then you just assume that it's best not for them not to put weight on it. As far as being responsible for administering appropriate first aid, again, that's going to be totally dependent on the amount of training the person has. If you're a personal trainer who also happens to have EMT training, your level of responsibility there is going to be different than somebody who only has first aid training. Athletic trainers will provide more complex care than somebody who is just first aid trained. And we are all responsible for making correct decisions in the management of an acute injury as our level of training dictates. If somebody only has CPR and first aid, they're going to be expected to call an ambulance if something seems like it's more than a very minor injury or illness. As athletic trainers, we don't always do that. I've sent people to the hospital with a relatively severe knee injury because I was able to splint it on my own. I've sent people with crutches and a boot to the doctor the next day, even though I knew that their ankle was fractured, because I felt that they were in a protected environment and were able to wait till the following day. And it wasn't a big deal. But as an athletic trainer, I have the experience to be able to make that decision. As a personal trainer, somebody wouldn't. So as far as treatment and rehabilitation goes, athletic trainers are responsible for this when it comes to the athletes that they are treating. We are able to do this under the law because we work under the supervision and direction of a team physician. Physical therapists are able to do physical therapy and injury rehabilitation independent of being under the supervision of a physician. So athletic trainers function under a physician, or in the physical therapy clinic, say for instance, I function under the physical therapist license. So athletic trainers can't just see a patient randomly. That doesn't really work that way if we were functioning specifically as an athletic trainer. So under the supervision and direction of a team physician, as athletic trainers, we can design rehab programs, supervise rehab programs, incorporate therapeutic modalities, which are different types of things we can use to help a person feel better or heal better. And we can offer psychosocial intervention. So that would be, say, for instance, if we thought somebody possibly was displaying disordered eating patterns, we might talk to them and say, I'm concerned about what I'm seeing going on here. I'd like to refer you to the team physician, and then possibly a dietitian, just to kind of see how you're doing with your nutrition. And most likely a team physician would also refer that that person to psychologists to make sure that they are healthy. So that would be one thing. So as an athletic trainer, we wouldn't be doing psychological counseling, but we can identify people who are at risk and make sure that they're referred to the appropriate resources. Now, a personal trainer or certified strength and conditioning specialist may help with late-stage rehab before return to play. Again, if somebody has finished their rehab program and they're kind of in an in-between phase where they're not quite ready to return to play, then they can be working out in the gym. Or I oftentimes I've had athletes who really love working out in the gym, and maybe they're not even all the way through their rehab, but they can do some things in the gym. We'll go ahead and let them return to the extent that they can, but we'll make sure that they're being very careful with their actual injured body part. Now, when it comes to organization and administration, this is going to be very dependent on the individual's job setting. So anybody who's witnessed an injury or illness at work should do some kind of record keeping when it comes to that incident. So in an athletic training room, we're going to do an injury report. Say, for instance, for a personal trainer working in a gym, you would probably do something like an accident report, just to make sure that there's a record of that incident in case somebody ends up, bringing up a lawsuit, say, for instance, or for athletic trainers, we need that record to know how we treated that person. And we follow appropriate privacy laws. Generally, as athletic trainers, we try to follow HIPAA, which is basically trying to make sure we're protecting people's private information. So that's one thing in particular, and we'll go over administration more in a future lecture. Another thing that people might do for organization or administration would be ordering equipment and supplies. For, say, for instance, a high school athletic trainer, they're going to order those for sure. In the physical therapy clinic, I have no responsibility for ordering those things other than to tell the person who orders them that we need them. A personal trainer may or may not do that depending on what their job description is at their particular setting. We may supervise personnel. As an athletic trainer, I have supervised other full-time people, other part-time athletic trainers, and athletic training students. I've trained people in various levels as well. So that could be a part of what we do or not. It depends on the job setting. Working in a high school, sometimes I was the only person, but I might have, say, for instance, supervised the water boy or something to that effect. As personal trainers, again, it would just depend on what the job setting was. We might establish policies and procedures for the operation of the athletic training program or fitness facility, depending on our level within the company or the athletic training room. Most of the time, if you're the only athletic trainer, then you're in charge of planning the policies and procedures. If somebody is, say, for instance, a grad assistant at a large university, they probably wouldn't have any responsibility for that at all. As far as professional responsibilities go, anybody who is a professional has professional responsibilities. So both athletic trainers and personal trainers would have this, in addition to physical therapists or physicians, things like that. Some common professional responsibilities would be education. So athletic trainers will educate athletes, coaches, and parents about injuries. And personal trainers would be more likely to educate clients about lifestyle choices and illness prevention. So that's just an example. Obviously, there could be other things that you're educating people about. Another thing that we're responsible for is promoting our profession. So, being a good example of an athletic trainer or a personal trainer, trying to act professionally, dressing appropriately, being clean and well groomed and acting appropriately, not having a foul mouth in front of high school kids, say, for instance. So really trying to do our best job to be the best model of our profession that we can be. counseling. So we don't have to have professional counseling skills, but listening to athletes or clients about their goals and challenges that they're going through would be a good example of that. Just being a good communicator is super important for these types of careers. And also research. So staying up to date on trends, having some idea of what's going on in our profession. A couple years ago, I had been out of the profession for, maybe 2 years, and I came back to there being completely different laws about concussion management for high school athletes, and I really should have made sure that I was up to date on that because I was working with 2 different high school groups, and all of a sudden out of nowhere, the recommendations for how long a high school athlete was supposed to stay out following a concussion was double what it had been, and that was a big deal. That was something that was really important for me to be aware of. So staying up to date on things like that is really important. And we can do that by reading journal articles or attending professional conferences or things like that. So some important personal qualities of athletic trainers are things like stamina and the ability to adapt. It's not uncommon as athletic trainers to, work 10, 12-hour days. I think the longest I ever worked as an athletic trainer was a 15-hour day. So that was something that just ended up being what needed to be done for that day. And it's what I needed to do to get my job done, unfortunately, that day. And another important quality would be empathy. We're working with people who are injured, who are going through a really hard time, and we want to try to be sensitive to that. So we try to put ourselves in their shoes and make sure that we are acting appropriately for somebody who is going through a rough time. But also having a sense of humor. Stuff happens. We deal with smelly feet. We deal with all kinds of stuff that's just gross. So we just have to have a sense of humor about ourselves and about other people without actually making fun of them. Again, empathy is still important. Being a good communicator with people at multiple levels. So I need to be able to communicate with a high school athlete about their injury, their parents about that same injury, and possibly the team physician about the same injury. The message that is going to those people is going to be totally different. I'm not going to try to talk to the high school athlete using medical terminology unless I know they have a background in that. But if I start talking to the team physician about how so-and-so tweaked their ankle, that doesn't sound professional. So it's important to know who we're talking to and gear our message appropriately. Intellectual curiosity is really important. We should never stop learning. I always want to know if there's some new way to do things or if I could do something better, because that benefits my athletes more than if I'm stagnant. We want to make sure we're practicing ethically, very, very important. We should always make sure that we are doing our best job and practicing within our scope of practice. And also professional membership. We should be professional members of the NATA, say, for instance. Okay, last but not least, when it comes to the different members of the sports medicine team that we're going to be talking about, is the role of our team physician. So a team physician will administer and review preseason physical exams. If somebody has a condition that makes it unsafe for them to participate, the team physician will disqualify them from that sport. And we'll talk more about that later. The team physician is going to diagnose injuries, and they're going to be the ones who make the decision for return to play if an athlete is sent to them. So if I have that athlete with the ankle sprain that does not go to the doctor, then as an athletic trainer, I get to decide when they return to play. Not the coach, not an administrator, but the athletic trainer. But again, if they've seen the doctor, then the doctor decides on return to play, not the athletic trainer. The team physician can dispense medications, so they can prescribe an albuterol inhaler for someone. They can give somebody a bottle of antibiotics, things like that. They're going to direct our rehabilitation program. So again, as athletic trainers, we are functioning under the direction of the team physician when it comes to rehab. So the team physician will also work with the athletic training staff to develop an emergency action plan. They'll help educate the staff on healthcare insurance coverage and legal liability. And they might be able to review medical forms, policies, and procedures to ensure compliance with school and athletic association guidelines if they have experience in those areas. Sometimes we'll also get help from administrators at specific universities for those things.